flexors at where? Iliopsoas and rectus femoris. So your patient needs to come down to the edge of the table if possible. It's going to be bilateral sides, both testing. Go ahead and hug your knee. If the patient's thigh touches the table, which for her it does, and the knee is at least 50 to 80 degrees of knee flexion, then this is a negative test. If it was a positive test, her leg would probably be up, maybe that high, but it wouldn't be touching the table. That's telling you more so it's iliopsoas versus rectus, okay? And then there's also a whole rectus test too. With your manual muscle lengthening, you can also take the measurements at the hip and at the knee. So go ahead and try the other side. A little bit on that left side, on the psoas portion. Not as bad on the right side. Okay, so then now we just make mental notes of that. That's your Thomas test.
Could you just repeat the degrees again? How you did it?
I'm sorry?
Like the starting of it, could you repeat the degrees again?
It's about 50 to 80 degrees of knee flexion that needs to be maintained. If they can do more, then obviously the rectus femoris is lengthened, it doesn't have an issue, then you're looking at just the psoas. Yes.
So psoas is fine, but there's not as much flexion as you're looking for. Would that still make it a positive for the test?
It would be a positive not for the Thomas test. You have to do just the straight rectus femoris test after that for the muscle lengthening to see what it is.
Okay.
Good. Good question. So Thomas test and then Ober's. What is Ober's test? Anyone? IT band TFL. Go ahead and lie on your side, please. Ober's test, you have two. You have modified and you have regular Ober's test. The modified makes the leg straight. Regular Ober's test makes the knee bent. It needs to be at least 90 degrees for the knee. There is a speculation in between both special tests. Why do you do it this way versus do you do it this way? Anybody want to kind of take a guess?
Would it be lengthening the TFL?
It's lengthening the TFL if you go straight-legged. Very good. That's one. It will lengthen more because it'll get into more adduction versus if the knee's bent here. Yes?
Modified is straight leg and normal is bent.
It's bent. Other things too is with the regular Ober test, if a person can't get into a knee flexion of 90 degrees for your total knee patients, they probably ain't gonna be able to do this. So then I would just stick with the straight, okay? People who have patellofemoral issues, the legs being straight is gonna pull a lot less on the patella, making the alignment more comfortable versus if it's bent. And then the last one is adduction. So you're here, roll your hips there. You're here. If the person was tight, they're gonna stop because you have impute on the ankle, because this can only go to the ankle, versus your leg straight, you can go behind. Okay? So that's just the differences on why one is performed than the other. But usually Ober's test, legs straight, hip flat, and they just have to, if they had tightness in the IT band and the TFL, it would stay up. If they don't, it would go down. Okay? So you don't need to drop it. I'm just showing you as a drop, you just kind of hold and make sure. Okay, you're guiding it. And the same thing for the straight leg. But it has to be in line with the body. Ober, modified Ober, Thomas. Piriformis. I did it in my video. Actually, let's go ahead and compare it to the other side. Go ahead and lie on your, okay? And here. And there. Okay. I'm gonna let it go. I'm gonna let it go. Don't bring it forward. Oh, a little bit tight on the right side. Okay. And then straight leg. Yeah, not too bad. Okay. So no positives yet. Actually. On your back.
What are we looking for now again?
So if the leg was to stay put, so as you are dropping the leg and you're not holding it, if it was tight, you can pretend, it would stay up. That would make it tight IT band and tight TFL. Okay, if it's loose, it will drop down into adduction. Okay, moving on. Onto your back, please. Piriformis. Short person issues. Can I have that stool? And then if you guys look online too, there's quite a few videos. I like using the Croatian guys. They're pretty good. Physio tutors, I think. That's what they're called. Alright, piriformis stress. It is a comparison. There is no degree measurement. For the special test, you're going knee approximating between 90 degrees, like 70 to 90. You're going into abduction, external rotation. You're bringing it up to. Okay? Piriformis. If it was tight, or if they had pain in piriformis syndrome, you apply pressure downwards through your hand, down through the femur. They would have some type of radiating shock. That would give you an idea for piriformis. Yep. It's not a grade 5, y'all. No, you don't know what that means, but I'm not just going junking through. Oh, this is tighter. Okay. And I'm not just going here and just slamming it in. It's more of a gentle overpressure, okay? Tight?
I can't tell, honestly.
So her right side was a little bit more restricted in movement pattern than the left. I wouldn't say it's positive, it's just tight.
You keep it at the 70-90, or do you like push a little
I'm pulling
more
it back
deflection
into.
and you-
So you're turning it out. Start if they can get up there, and if they can pull it up. If they have the mobility, yes, you can. And then you are pushing down. But in between 70 and 90 of hip flexion, and then the external rotation and abduction.
And you're feeling the tension on.
You're feeling the tension as you're doing the movement pattern, and then seeing, and then you're also applying if there's pain at the end.
What if they just have like a high pain tolerance and they're not saying anything?
There's, as you practice more, you'll learn that people have facial grimaces, so no matter how high their pain tolerance is, they tend to make some type of eye twitch, head movement, even though they say it's all good. Just note it, and that's the comments that you're also looking at too. Straight leg raise. Yes.
Real quick, so you said that to push down, they're gonna feel like shock.
If they have piriformis syndrome, that shock feeling that you're getting is on that sciatic nerve. If you remember from piriformis, then that's telling you that there's a positive test for sciatic too.
Yeah, I was just curious, if they don't feel a shock feeling, but they still feel pain, is that necessarily a negative result, or is that
No,
positive?
it's still positive.
It's still positive?
Mhm.
Okay. Thank you.
Was that your question?
It looks like when you press down, you moved your back into the flexion plane instead of abducted. Is that purposeful?
I see what you're saying. Into adduction. More so for me, I'm doing it to test the full mobility of the piriformis. If they're good and they're there, you can just stay at that 70 to 90. But I'm also just testing it out through here because this is going to give me that full end range of that piriformis stretch. Moving on. Okay. RJ, come. Thank you. He's got hammies, that's why. This will give me more.
Sit down forever? Or-
Yeah, sit down. Or shoes off. Alright, so we talked about RJ and his PMF stretching, and I doubt he stretched at home when he went home, so we'll still see his
No.
stuff.
I sounded nervous.
For straight leg raise, I gave you guys the functional test that I learned in my CEU between the hip and the knee, and you're taking that midpoint, and if they can straight leg raise above that, then you know that they don't have that hamstring tension. For the test, I believe, the true measurement, it needs to be 70 to 80 degrees. I don't want to give you false information. Is there a question?
No, I'm just kidding. Yeah,
Just wondering how much that was. I was wondering if it.
I got you guys.
How much this is?
Yeah.
Look online. Some people sell them for pretty cheap. I say though, if you're gonna buy
It's my
it brand
iPad, but
new
he'll send it to him.
and you don't want to buy it used, there's a 20% discount from your red book.
On Amazon, it was
What's in
$40,
there?
just straight 40.
Yeah. Yeah, we're good there.
That was just the first one I saw.
It's not bad.
I'll consider it. I'll consider it if you bring me coffee.
Does
Okay.
that have a muscle
Yeah, it's heavy.
That's okay. As long as I don't gotta pay for it.
70 and 80 degrees. For your muscle lengthening, that's where I got that measurement. 70 to 80 degrees of hip flexion for the hamstrings. But that's not stated in the SLR special test, okay? So, with knee extension. So they have to maintain the extension. If for whatever reason they start to break, you stop. They're no longer there. Okay? So we can do that. So straight leg raise, other leg is flat, this leg is straight. Go ahead and kick up, toes towards you, knees straight. As high as you can. Life goes on, that's all good. She's at, jeez Louise, sir. He's at 51 degrees.
Have you set up
So,
pretty
and then comparison on the other side. Go ahead, keep straight.
Oh.
Crazy.
53.
Oh, let's go. PRs.
PR.
Okay, so is that positive? Yes. The other one too is 90-90. 90-90 of the SLR, so they are holding underneath their knee. So 90 degrees of hip flexion, 90 degrees of knee flexion, and now they're going to go ahead and straighten. If they can completely straighten the leg, then it is negative. It's a positive, because he can.
Yeah, we're not failing no tests around here.
Go ahead, switch. Yeah. Okay.
A for effort.
So now you get to see what positive tests look like. Tripod sign and Eli's test, these are more for contractures, but still really nice to see. Go ahead and sit up. Eli's test is for hip flexor contractures and tripod test is for hamstring. So if your patient is sitting upright, if they do any compensation from this sitting upright position, then it's a positive test. What you're going to do is you're going to extend the leg. If he was to do what's called a slouch, so he would probably slouch out, or if he put his hands behind his back to kind of offload, so that way, you know, as the leg comes up, you tend to lean back, then that would be a positive test. But, you know, false positives are to, again, facial grimaces, right? So. Again, more so for contractures. If a person was truly contractured, meaning that they weren't able to get the long lever stretch, you would, or there's more to contractures. Where's he at? He's not here. I'll let him explain that to you. But okay, so that's for hamstrings. Eli's test is for rectus, so go ahead and lie on your stomach. For Eli's test, you are bending.
Was that Eli's or tripod?
Tripod. Tri for hammy. Tripod. For Eli's test, it's hip flexion. So if a person truly had a hip flexor contracture, this is after your total hip patients, I want to say, give or take like 4 weeks, 4 to 6 weeks, you can start stretching them in. If it's an anterior incision, anterior lateral incision, they can start learning to go into prone. They would probably still have that flexion at their hip because they have now just been cleared from their precautions. So if you were to bend their knee, their hip would probably blaze up. That would make it a positive Eli's. Okay? For a normal person, full knee range of motion, keep that hip down. Good.
Is there a certain amount of lift you're looking for? I
For a
saw on this
contracture?
side, a slight lift up.
Yeah.
Would that make it positive or?
It would be more so for your proximal, not your distal. So then he does have. Go ahead and lie down on your back. We'll see if his Thomas test. Good job, I didn't see that. Bring this knee to your chest. No, not on the right. Switch. Bend your knee. At your knee. Yeah, good job. So then it is. So then you
So
got
it's just a
iliopsoas
slight
type
touch.
Thomas. Good job. All right, so break up with your partners. Do those 8. Yes, sir. Yes. So you're bending. You're taking out the rectus.